So treatments for eating disorders are typically divided into those for children and adolescents and those for adults. And the reason for that is that if you get an eating disorder as a child or young person under the age of 18, you're very likely to live at home with your parents and other people, your family support you around your eating. So treatments for the under 18s are usually family focused. This can be an eating disorder focused family therapy for anorexia nervosa or for bulimia nervosa, or it can involve several families of young people who are affected with an eating disorder, which is called a multi-family group. And we know that these treatments work very well because empowering the parents is really helpful at getting young people to reverse some of the behaviors that drive them into the eating disorder. So for adults with eating disorders, typically we offer individual psychological therapies. And the most widely used and best researched treatment is cognitive behavioral therapy. This can be used for people with anorexia nervosa, bulimia nervosa, or binge eating disorder. And it's a specific eating disorder focused form of CBT, which has been developed by colleagues in Oxford, Professor Chris Fairbairn and colleagues. This focuses very centrally on the weight and shape concerns that people have and tries to help people interrupt the vicious cycles of thoughts, feelings, and behaviors that keep the eating disorder going. Other individual therapies, especially for adults with anorexia nervosa, have also been developed, which look a bit more broadly at what drives people into an eating disorder and maintains the eating disorder. So we have developed a form of psychotherapy called Mantra, and colleagues in New Zealand have developed a form of psychological therapy which is called specialist supportive clinical management. All of these different treatments are structured outpatient therapies. They're all recommended by NICE, and finding the right one depends on what's available in a given eating disorder service, but also what is right for an individual. We know that the psychological treatments we have for eating disorders are effective in a good proportion of people, especially if people come early on in their illness, so come as teenagers, young people, young adults, when they have their first episode of illness, and come soon after their problems started. The reason for that is that over time, eating disorders become very habit-like and ingrained, and there is a lot of brain research supporting this idea. So you want to get in there early with treatment. So if you get treatment early, recovery rates with best available treatments are around 50 to 60% with a first treatment. And other people may also benefit from treatment, but may not yet make a full recovery. When we look at the picture overall of all people with eating disorders, including those who have had multiple treatments, there is a sort of hardcore of people who develop, unfortunately, a very persistent form of illness where they may have to have several courses of treatment to get to a full recovery. Really important is to say that even after you've had an eating disorder for a very long time, you can still make a recovery. It's just that we as clinicians may have to try to help figure out how we can help people to move forward and to take steps in the right direction, especially when they feel perhaps rather demoralized after treatments haven't been so effective. Some people make good recovery with a first episode treatment, but then when they're facing some stresses later on in their life, the illness may reoccur and they may have a relapse. And again, people can often make a full recovery from a second episode too.